right, good afternoon, everyone, and welcome to today's DEI-focused conversation, where we'll explore strategies to increase donation and transplantation within the API community. My name is Deanna Fenton, Senior Manager of Educational Program Development here at the Alliance, and it's my pleasure to kick off today's discussion. Now, today we'll discuss the various perceptions of organ donation across different Asian and Pacific Islander American ethnic groups, and we'll highlight best practices established to increase donation and transplantation rates within this community. Now, following today's presentation, we'd like to encourage you to stay with us for an additional 30 minutes to participate in our interactive breakout discussions, where you'll have an opportunity to engage with our presenters and share your own experiences or ideas as it relates to instilling trust and improving donation within this patient population. Following the breakout discussions, we'll return to the main session where we'll collectively share some of the key takeaways captured in your respective breakouts. Now, as always, your thoughts are incredibly valuable to this discussion, so please be sure to take advantage of the chat feature so that you can actively engage with your colleagues and our panel. Throughout the discussion, please feel free to submit any questions or comments you may have. Additionally, for those of you who may be joining us today in a group, I'd like to ask that you take this opportunity to complete the following poll to indicate approximately how many people have joined your group. Lastly, for those of you who may be interested in continuing education credits, please note that we are offering one CEPC credit and one nursing contact hour for your participation in today's discussion. Following the conclusion of the program, you'll receive an email from us with detailed instructions on how to claim your credits. Now, as a friendly reminder for all, you'll have 30 calendar days to complete the evaluation and claim your credits. Now, with that said, I'd like to begin the program by welcoming our moderator, Michael Munoz Romero, Clinical Coordinator of Cardiothoracic Transplant at Keck School of Medicine of USC, and a member of the Alliance's DEI committee. Michael, thank you so much for joining us to be a part of this discussion. I'll go ahead and turn it over to you.
Thank you, Deanna. Go Trojans. Anyway, my name is Michael. I am the current clinical manager for lung transplant over here at USC. And, one of the discussions that we want to take part today is that we all know that organ transplant often represents a life-saving treatment for patients with organ failure. The need for organ transplantation has been increasingly steady, but the number of organ donors has remained stagnant. Among the ethnic groups in the United States, Asian Americans and Pacific Islanders have the greatest disparity in the demand and supply of organs. And part of that, Asians being the fastest growing minority group in the United States, currently comprise about 8.5% on the transplant waiting list, but only about 2.5% of deceased donors are Asian Americans. It's widely reported that racial and ethnic minorities, including Asian Americans, Pacific Islanders are less likely than Caucasian Americans to register as organ donors, but the reasons for this difference is incompletely understood. Diabetes and heart disease are less prevalent among Asian Americans compared to other minority groups. However, we appear, I'm including myself in that, being an Asian American myself, we appear to suffer significantly from liver disease and hepatitis. And with that, these conditions are known to put patients at risk for organ failure. And the number of organ transplants performed, for example, on Asian Americans in 2020 alone is about 24.7% of the number of Asians currently waiting for a transplant. I think in the beginning, Deanna had mentioned there's about 10,000 Asians and about 625 Pacific Islander patients on the national transplant waiting list that are waiting for a life-saving organ transplant. So in today's panel, as we will describe, we want to explore the varying attitudes in behalf of the Asian American and Pacific Islander community. But at the same time, I want to be able to kind of explore a little bit more about that, because when we're talking about Asian Americans and Pacific Islanders, oftentimes we have this misconnotation or belief that it's geared towards a specific group, mostly the Chinese, maybe Vietnamese community, and then we're forgetting that Asia, as we are defining them now, is actually a wide group of participants. And so in that discussion too, a lot of them, it appears that despite our attempts at education and awareness, the most commonly reported barrier to organ donation registration, it remained to be the lack of knowledge about organ donation itself. And part of that is, the disparity or the distrust of healthcare and allocation system, cultural avoidance of death-related topics, and the desire to keep the body intact. So I think some of that will also be discussed by our colleagues here as they'll describe them today. Our first speaker is Heather Gardiner. She is the Associate Professor of Social and Behavioral Sciences in Temple University's College of Public Health. Heather directs the Health Disparities Research Lab in the Office of Community Engaged Research and Practice, which leads growth to the college's interdisciplinary community-based activities for research, teaching, service, and practice. She is a mixed methodologist with a program of research focused at the intersection of interpersonal health communication and organ and tissue donation and transplantation. Heather has a strong record of externally funded research to increase access to transplants for the underserved minority populations for which community engagement remains a core component. Heather earned her doctorate from the State University of New York at Buffalo and her master's in public health from Virginia Commonwealth University. And it is my pleasure to introduce to you Ms. Heather as we talk about some of the things that we can do to engage and increase our awareness.
Thank you so much. And thank you for the invitation to be here today to share the work that we've been doing with this particular population. Can everybody see my screen? Yeah, great. So I'm going to talk about one particular study that we have been engaged in for the last 4 years, and I can't talk about that without acknowledging all of the people that have gone into this project. So Dr. Laura Siminoff, who is basically the mother of organ donation research in the US, led this project. We also had Gerard Alolad, who is, I think he's here today, and some research staff. We also had a community advisory board that informed all of the work that we did across the last 4 years. In addition to these folks, we had some Asian and Pacific Islander American organizations, community organizations that contributed as well. So what I'm going to present to you today couldn't have occurred without the help of many. So the project was titled Understanding and Planning Donation Information Needs of Asian American Communities. And ultimately, like Michael just mentioned, really the goal was to increase the number of Asian and Pacific Islander Americans who are registered organ donors in the US. So thank you for that great introduction to the background of the problem. But ultimately, the passage of the 2007 UAGA, which made donor registration really an important part of the conversion process. Now we're trying really hard to focus on getting more people registered. So that was the overarching aim of this project. Much of the work we did was formative. So we used a community engaged approach. So we had all of these folks that were part of the project. We met monthly with our community advisory board, who informed things from the language used in our recruitment materials and surveys to the actual intervention that I'll talk about later on. We used some focus groups in order to understand knowledge and attitudes about organ donation among this population. We conducted the first national survey of organ donation attitudes and knowledge among Asian and Pacific Islander Americans. And then we created and tested an animated video that we were hoping would really lead to increases in registered organ donors. So we had 9 focus groups with 64 participants, and we really tried hard to get a diverse group. So we had 20 Chinese, 22 Filipino, 22 Vietnamese participants, and the groups were held separately, and some of them in their native languages. So we really wanted to understand both people, attitudes and knowledge of both the folks that were raised in the United States, but also those that came from other places and held on to those cultural values and language. And then in our national panel survey, we actually had over 2,000 responses, almost 900 of which were included in the analysis. And again, we tried really hard to get a very diverse representation from across the number of different ethnic groups that are in the larger bucket of Asian and Pacific Islander American. So I'm going to start with some results from the focus groups. We gave a brief survey to everybody that participated in the focus groups before we engaged in the discussion. And remember, we only had these 3 groups, but we found with this very short survey that focused on willingness to donate their own organs and willingness to register as an organ donor, some stark differences between groups. So for the Filipino Americans were the most willing and the most likely to have registered as an organ donor already. And the Vietnamese group exhibited some of the lowest levels of both. So that was very interesting to us. And you'll see in a few minutes when I talk about the national survey, we actually broadened the number of categories of Asian and Pacific Islander Americans that we were collected information from. And we found even consistently differences. So much of what I'm going to talk about with the focus groups can be found in this paper. If anybody is interested, I'm happy to send you a copy. Just shoot me an email. But in terms of knowledge and attitudes about organ donation, we found that Chinese Americans actually demonstrated some of the lowest levels of knowledge, Chinese and Filipino, across the board, with Vietnamese Americans demonstrating some of the strongest levels of awareness. All 3 groups, surprisingly, really thought that there was an illegal black market for organs in the United States. So only up to a third of the those that were surveyed were correct in actually saying that this did not exist. In terms of some attitudes, these were the 2 that were most commonly agreed or disagreed with. So rich or famous people who need a transplant are more likely to get a transplant from others. More Chinese Americans felt that this was correct than other groups. And when we talked about directed donation, the question asked, I think that when families donate, they should be able to ask that organs go to a particular person. The Vietnamese American group felt more strongly that that should be the case. So again, we find some really interesting differences across these 3 groups. And then when it came to some of the themes that we were able to extract from our discussions, we did find overwhelmingly positive views on organ donation across all 3 groups. Many of the folks that we talked to felt like if there was a possibility of helping somebody out, that they would want to do that. So that feeling of altruism that we've found for decades as one of the reasons to donate was definitely echoed here. Interestingly, though, when we talked to older folks, the views became less positive and more mixed. So we found a generational difference that was actually exhibited in almost every theme that we found. So we also found that a lot of people were exposed to organ donation and were quite aware of what organ donation was. But again, we find that some of the older generations frowned upon people, their children, their family members actually signing up. So if you read the bottom quote from one Filipino female in her 70s, so she says, I think older Filipinos look at organ donation differently because my children signed up to be organ donors, and I said, why did you do that? So older generations of this particular population tend to look negatively upon organ donation as really asking their children not to actually register. So we found really one of the primary drivers for this was the primacy of the family. And some of the people that we spoke with, again, mostly the older Americans, they felt like they would donate to people who were in their immediate social networks, like friends and family, people like them. But if it were somebody outside of their family, that they would not be so inclined to donate. And this Filipino male who was 19, he said, when I was going to get my license, I was told by my mom that I was absolutely not going to be an organ donor. She did not give me a choice. And this primacy of the family and this hierarchical structure is really important. So he, of course, obeyed what his mother said. And this is a theme that we found throughout our focus group analysis. Part of this was also because of just general fear and mistrust. So this is a myth that we've, again, heard over and over as a refrain for why people would not want to donate. But one Vietnamese male claimed that his mother told him that if he was an organ donor, he would not be helped by the doctors if he were in a critical condition. So this myth is pervasive. Another Vietnamese female in her 60s, she says that she didn't really hear about a black market here in the US, but she did hear about one in Vietnam, and that people kidnap their kids to sell their organs. So even if it isn't focused here on the United States, this idea of this black market happening anywhere is influencing organ donation attitudes and behaviors. And then there were also some very strong religious and cultural beliefs about death in the body. And I think, Michael, you made reference to this in your opening as well, but there is some hesitance to talk about death, and then it kind of as a forebearer of it happening. So this Filipino male in his 20s says, I would say that things that render death are more taboo. So my grandmother doesn't want any photos of bodies of water because she thinks it'll drown her in her sleep. So this sort of reluctance to talk about death because it will bring it on is one reason why families have not had conversations about organ donation. There's also issues around body wholeness. So this Chinese female in her 60s notes that people want to maintain a complete corpse after death. So she's not sure that she will ever donate because of that factor. Interestingly, we also found that many of the folks we spoke with really felt excluded from mainstream American society. And I think this quote really represents or reflects that sentiment. So this was a young Chinese male. And I do wonder how much the impact of COVID and the anti-Asian American sentiment that has been all too prevalent over the last couple of years has had some impact on this. But he reflects and says, I don't feel like we're part of this group of Americans. This country is not made for us. And I think that really makes them feel protective, so he goes on to say, if I knew my organs were going to a Chinese person, I would be more inclined to help this person. I would definitely be more willing to help another Asian American than someone white. So after we had a pretty good understanding of where these different groups fell in terms of knowledge and attitudes, we really thought that a national survey, something that got us, first of all, a larger sample. We only had about 64, 67 people in our focus group, so we wanted a much larger sample to be able to make some stronger generalizations or claims about organ donation knowledge and attitudes among this particular population. But we also wanted to be able to get a more nuanced understanding of this large, very heterogeneous group that is often condensed into this one one title as Asian American or Asian Pacific Islander American. And there are a lot of differences we saw already from the focus groups, but the national survey really provided, it illuminated that, even made it much more clear. So from our national survey, which had, like I said before, over 2,000 responses and about 900 that we could use, we found that about 40% were registered organ donors, but more said that they were willing to donate organs after their death. So we needed to, we clearly need to make some changes in how we're talking to these folks about organ donation and registration. So there's a missed opportunity right here that is, kind of low hanging fruit. 21% said that they would prefer to actually allow their family to make the decision for them upon their death. About 30% would donate a family member's death after, a family member's organs after death. And just over half would donate only if they knew what the family member wanted to do in terms of organ donation. So I realize this slide is a little messy. It's got a lot of information here, but we were comparing the different subgroups within the larger Asian Pacific Islander American population in terms of first willingness to donate their organs after death, willingness to donate a family member's organs after their death, and whether or not that they would donate, whether the wishes were known. So you can see there's wide variation across these, how many? We have 7 groups here. And we had very few numbers within the other Southeast Asian groups and other Asian. So we tried our best to, kind of get a good enough number so we can make some comparisons, but we still feel like these could be separated out even further. Regardless, you can see in terms of willingness, Japanese Americans claimed the greatest willingness to donate their organs after death. And I believe if you look carefully, Chinese Americans had some of the lowest levels of agreement to that particular statement. In terms of willingness to donate a family member's death, again, Japanese, a family member's organs after death. I apologize, too much coffee today, maybe. About 50% of the Japanese subsample were willing to donate a family member's organs after death. And some of the lowest levels of that were actually found upon within the Filipino and the Chinese American subgroups. And then whether they would donate if their wishes were known, if the family members' wishes were known or not, you can see this actually falls among the Japanese Americans, whereas Filipino, Chinese, and other Asian were some of the highest. So as long as they understood their family members' wishes, they would be willing to donate. So I think this really is quite telling. We cannot try to clump every Asian American into one category or approach all Asian American families the same way. We really need to understand the nuanced differences that each family has with respect to their attitudes and beliefs about organ donation. And just trying to make assumptions is really not helpful. So we also were curious about whether being born in the US or raised in the US made any difference. And so folks that were born in the US had slightly more willingness to donate their own organs, considerably more willingness to donate a family member's organs. And this last one, whether donation wishes were known, this is about the same across the board. But if they were neither born in the US or really raised in the US but emigrated, you can see this had some of the lowest levels of willingness to donate their own and a family member's organs. So immigration status, I think, does matter. And in terms of religion, we found, again, some interesting findings. So Hindu, those who are self-reported Hindu, expressed some of the greatest willingness to donate their own organs after death. And that was even higher than Protestant and other Catholic, so Protestant and then Catholics over here, and other groups. But we also found that This particular group held some of the strongest willingness to donate a family member's organs after death. And you can see too some differences here in terms of if the family member's wishes were known, whether they would donate. And here we found that the Catholics and the Protestants had some of the highest here. So I think, again, really reflecting the need to consider each family as unique. So some lessons learned and some practice recommendations from this project. You really can't assume that this moniker, the Asian Pacific Islander moniker, is a homogeneous group. So we need to really, when we're talking to families, use some active listening and use some probing questions. I apologize, my dog is going a little crazy here right now. Probing questions to uncover underlying knowledge and attitudes. So assuming all families are the same because they fit this title of Asian Pacific Islander is really doing them a grave injustice. We also need to identify a family matriarch or patriarch. So even though we may have a next of kin who is a father or a mother, they may not hold the most influence over the donation decision. Instead, it may be a grandparent or even a great grandparent. So making this a family decision is really important. And really making sure that that particular person who is most influential as part of the conversation is also very important. We in the US tend to think of the decision to donate as an individual autonomous decision. That's like our cultural values. And I think that we are a bit misguided if we think that that applies to everybody. So what we see in the results of our project is that family does come first, and individual autonomy and decision-making is not as important as really obeying or bowing to the family hierarchy and the wishes of those who are older than one who is interested in signing up. We also need to acknowledge feelings of exclusion while highlighting the need for donors of Asian American heritage. What we do know is that there is a greatest need for donors who are of blood type B, and that is Asian American and African Americans. So if we really are able to demonstrate, like if you donate, you're more likely to have your organs go to somebody who is blood type B, and that is most likely Asian American or African American. And I think also discussing the possibility of directed donation would go far as well. Interestingly, I had a conversation with our local OPO here in Philadelphia who noted, like, if we're able to get people to agree to directed donation, it keeps the organs within their DSA, right? So that they don't get shipped elsewhere, and that gives them better numbers, basically. So if we're not talking about directed donation yet, I think it's very important that we need to do that. But ultimately, I think it is really important to just raise awareness about organ donation and the need for organs in the Asian American community. So what we did with this information was develop a family-centered animation that we called Heart of Gold. And this was culturally and linguistically tailored specifically to Asian and Pacific Islander American populations. And so I think I have a little bit of time left, so I can share this with you. It's about 1.5 minutes. And if we can find ways to really get grow an awareness of the need, I think that will help when people are in the situation where they're asked to donate in the hospital. And for some reason, oh, here it is working. Maybe my computer's just incredibly slow today. Oh. I may have to show you another time after I fix my link. It was working and it's not now. So I will try to repair this. Maybe I can share with you at the end, but I don't want to hold up Felicia's contributions to this conversation. So I guess at this point, if you do have any questions, I'm happy to answer as best as I can, or actually, I'll let Michael
Yeah,
take us
thank
away.
you. Thank you, Heather. What an amazing study that you shared there with us. What kind of stood to me the most, in fact, as I'm watching you go through all the quotations with all the families that was a part of that study, is that I think what we I don't know if it's a failure for us as a community in transplants or a failure for us as people to begin with, is that we never talk about our own wishes, right? I think everybody wants to donate. You can see the disparity on your slides where there's like this big gap that I'm willing to donate 60%. You know, after my death, I want to do this, but yet you don't want to decide for another person. And I think that's where really the gap is where we don't talk about death with our family, despite the fact that death is a part of life. And I think that's kind of like where we need to probably focus on educating some of our peers when it comes to that. You know, I got more involved. I took care of transplant patients as a nursing graduate. I got my bachelor's in the Philippines. I worked there for a little bit, and then I moved here as an immigrant. So I completely can relate to all these topics that you were presenting. It's like, yep, I was one of those. Yep, my friend was that. And it's amazing that it's bringing me back to that place. But at the same time, in my own research, through the years that I've been in transplants now for about 25 years, what I found was that we also as a community is not educating people, the general public, enough about brain death. And when they don't have an understanding on what brain death is, they don't think their loved one is dead. So how can they donate? And it's interesting that, like I said, in my own kind of review, the brain death law in the Philippines, for example, has been in place since 91. I graduated in 96. I never heard about it. I came here, worked at One Legacy, and in 2014, I went back and looked, is there a brain dead law in the Philippines? And lo and behold, it's been around for over 25 years and nobody knows about it. So I don't know if that's something that kind of stood out from like your own study, if that ever came up.
That's a really great question. That wasn't an item that we asked people for, feedback on. But I do think historically there has been a lot of research that points to some confusion around what it means to be brain dead, and that's, I think, for all of us, when we're in the hospital and somebody is ventilated and looks like they're, they have color and they're warm to the touch, it's hard to think that they're dead, and so I agree. I think that may be one way that we can help move the needle, is by helping people to understand what that means. And in the hospital at that really tragic point in time, it may not be the best time to do that.
Right.
It's just harder to understand. It's harder to listen. It's, we should be trying to do as much as we can before they get into that situation, is what I would say.
Definitely. No, thank you for that. And I know I'm just looking at some of the questions too that was submitted earlier on by some of our participants here. And I know a lot of them is likely going to be discussed by and shared by Felicia with some of their own research and some of their firsthand experience dealing with their own population in Legacy of Hawaii. So I'll go ahead and introduce Felicia so we can discuss, the next part, and maybe share some of the tips that they've done in her own OPO, and see, to kind of mix together the results of Heather's research and then what they're already doing in some of the these places like Hawaii. So Felicia, our next speaker is Felicia Wells Williams. She's had this career spanning about 3 decades in organ donation. She is the director of clinical services at Legacy of Life in Hawaii. She began her nursing career in pediatrics, caring for children and their families. And in '94, She accepted the job as a donation coordinator and was drawn to the amazing family she was privileged to meet. She has led a career committed to the compassionate care of donor families and to saving and enhancing lives through organ and tissue transplantation. She leads a diverse team of professionals in Hawaii that are responsible for a full spectrum of organ and tissue procurement, from referral, authorization, management, and recovery. Felicia shares Legacy of Life Hawaii is the smallest of the 57 OPOs, and yet they have a huge impact on the lives of people in Hawaii and the Pacific Basin. So, ladies and gentlemen, here's Felicia Wells-Williams.
Well, it's morning in Hawaii, so good morning, everyone, or good afternoon.
Morning.
In all the places that you are. Thank you so much for this opportunity to share a little bit about our work in Hawaii. I want to start off actually really just sharing with you and trying to get my slides to move, give you a little bit of information about what's unique about Hawaii, where we are, but really start off with you coming from a place of humility. I am not a cultural expert, so what I'm going to be sharing with you today is really my experience and our experience with the families that we work with. So I hope that you'll find the information helpful. So while this map is not completely accurate as far as like Hawaii is not quite that large in the scheme, of the world, I did want to just demonstrate for you how isolated we are. We are the most isolated landmass in the world. And the majority of our population is Asian and Pacific Islander, far outpacing other cultures. So one of the few places, I suppose, in the United States in which Caucasians would really be considered the minority. A third of the people that live in Hawaii are first or second generation immigrants, excuse me, and based on our proximity to Asia, many of the immigrants are from Southeast Asia, and from Micronesia. We're a multi-ethnic community, and that's really demonstrated really in our food. Anybody who has had an opportunity to travel to Hawaii would know that, the really unique food mixtures and the famous mixed plate lunch that would include foods from many different ethnic groups. The largest immigrant community in Hawaii are Filipinos. And so I think with that information, it really puts us in a unique position to be able to share our experiences and our perspective. I did want to share one of the things that I've even learned, and that's why, again, I come with humility, is I put together this word cloud, and yet as we learned, the real definition of Asian, which is what I've, even learned as we're preparing for this presentation, my word cloud includes the communities with which we are most likely to interface within Hawaii, but we know that it goes far beyond the cultures that I've identified here. I want to share a little bit about some of the local research that has occurred. One of our family services coordinators, Kaiwi Ola Coakley, really wanted to challenge some of the assumptions that we were making related to the Filipino community and their beliefs related to donation. So Kaiwi did some work. He did literature searches, found many articles related to donation attitudes in Hawaii, but Asians around the country. And he also did some demographic studies in Hawaii, as well as reviewed a 3-year data set of information on families that we had interacted with. And so one of the things one of the primary takeaways from the research that Kaiwi did was really made clear that ethnicity, culture is not a reliable predictor of someone's willingness to register to be a donor, but really also the outcome, the outcome of a donation conversation or willingness to consent to donation. Kaiwi postulated that immigrant status had a great impact on that willingness. And when he outlined it for us a little bit and talked about whether someone, it's interesting because on this slide it does, it says foreign born, but foreign born from the United States. You know, Filipinos who are born and raised in the Philippines and then immigrate to the United States, you know, large population that we have in Hawaii, but we find that for those that are born and raised in Hawaii, their tendency toward acceptance of donation is greater than those who were not born or who do not have significant life experience in the United States. In the results that he found, those from the Marshall Islands and from Micronesia, while they're not a part of the immigrant numbers that we shared, they are permanent residents based on, you know, government agreements with the islands of Micronesia, but they definitely are similar in that belief set, where if they are Micronesians that were raised in Hawaii, their attitudes, or in the US, their attitudes are different toward donation than those that are immigrants. And so just kind of in summary, what he really outlined and found in some of the articles is that the people who were responding to different surveys that had occurred, if they were born in the United States, they were 3 times more likely to be designated donors than if they were born in the Philippines. And then time in the US incrementally increases the likelihood that someone would designate themselves to be a donor. So that really leads me to where I want to begin to talk to you a little bit about our experience and what we've done, or how we go about working with families from diverse communities. And so it's really important that we start from a place of compassion. So compassion before consent. And this is something that has been shared with us over the years, in particular by Cherry Wise. I'm sure some of you might be familiar with her. She's an amazing consultant and educator and has done work around the country. But she has definitely been a major influence on us, and really highlighting and is a hallmark of the work that we do in our diverse communities, that we always begin and come from a place of compassion. And so with that in mind, that means that ethnicity and culture are only going to be a starting point for us. It is not the defining, it is not going to define the outcome. And so I want to challenge you, and as for us, it really requires that we redirect ourselves, and that we don't enter into conversations with a expectation of a predetermined outcome, that we're very conscious of the individual families that are before us, and that we respond to each one in that way. So in the conversation, I think one of the things that's really important is that we, enter into conversations open and unbiased, and that we don't group people together. As Heather was alluding to, we don't stereotype and say that because you are this, then this will be your decision, or this will be your outcome. And so if we enter into conversations with individual families, really intending to understand this specific family. What I mean by that is, so if we're talking, for example, to a family whose culture is Chinese, it's important for us to, have some understanding. Is this a Chinese American family born and raised and educated in the US? Or am I speaking to a family who's visiting Hawaii from mainland China? And so their understandings and acceptance of donation, or their lived experiences, are going to be quite different. And so we want to be open and really seeking to understand that family that we are speaking to. I think one of the generalizations that I am comfortable making, in particular in Asian communities, and again, it's something that Heather spoke about, and that is the concept of families making a group decision or consensus decision rather than focusing on individual autonomy. And so for us in Hawaii, it is not uncommon that we will speak to groups or speak to families in a large group setting, working hard to include as many of the key family members or community members as possible, so that they can receive the information from us, all at one time, and we can answer their questions. And this is important because often the person who, according to the UAGA, has the legal authority to make the decision may not be the person that has the influence to make the decision. And so that's one of the things that's really important to identify early. And we can find this out often from the hospital staff as we're communicating about some of the family interactions that have occurred prior to our involvement, to really begin to understand who are the key people that are important to be a part of this decision. Because just because a young adult son may have the authority to make the decision, if he is deferring respect to the grandparents or to the uncles and aunties, we want to make sure that we include them in our conversation so that all are coming from a place of understanding and can make an informed decision about donation. Another generalization that I'm comfortable making, but again, without stereotyping, but just a generalization, is the value of harmony, the value of unity. And again, that goes to the idea of a consensus decision and less of the autonomy of the individual. And so when we speak to larger groups of families and decisions about donation are being made, we rarely find families that are in conflict, meaning that if there is a portion of the family that supports donation and another portion of the family that is opposed, often those that are supportive will defer to those that are opposed in that desire for unity and harmony. And so while that may provide harmony for the family, it can ultimately end in an outcome of decline for donation. And so again, that's why I challenge you to make sure that you include the wider group for the conversations about donation so that we don't inadvertently put a burden or responsibility on that person with the authority to make the decision to have to communicate that to those with the influence. We want that group to have the opportunity to hear the information together. I think the other really important thing about that larger group, though, that we're talking about is really using that family conversation as a time to educate and inform about brain death and about donation. You don't want to assume that those that you are speaking to have an experience with it or have an understanding. And so we really want to provide foundational information, ask open-ended questions, and find out what is the understanding of the group that you're speaking with so that you can make sure that you share the full details and information. You also want to be attuned and listen to the family and their needs for end of life rituals, the funeral rituals, so that you can talk about how donation can be a part of that. What we find often, particularly in Pacific Islander communities, and in the pre-COVID era in particular, families would gather in large groups. They would bring food, share food. That's how they would really love on and care for their community and for their family. There'd be songs, whether they were faith-based or culturally based. So we want to make sure that we provide families with the time and space to be able to gather and participate in those rituals. And then it's upon us to find ways in which to create a sense of donation as being able to be a part of that end-of-life care. And I would further challenge you to really address the myths and barriers that you may identify in your conversation, or that you may know about the community, as we talked about with Heather, concerns about the Black market, concerns about organs going only to the wealthy. Do not wait for families to ask those questions. Make sure that you proactively share and address those, if you believe that they are concerns that the family has, because they may be bringing that into the meeting, into the conversation with you, and yet not be willing to ask it in a question or to provide that information to you. I think it's also really important that we talk about the need for donors and what transplant means in the community. Really talk to families about the impact of the life-saving gift so they can make that connection. Again, depending on what someone's experience is with healthcare in the United States, they may or may not have a solid understanding. And so we need to be really clear in sharing what that means. One of the really unique things for us in Hawaii is that our same team that talks to families in the hospital is the same team that provides aftercare for families. And so we're really comfortable talking to families in ways so that it's really clear we are not there to take something away from families. We are there to offer something. We're offering hope. We're offering hope to a community, and we want to help that family identify who that community is. And we also want families to know that we're there to walk this journey with them, that we're not just here, again, requesting or taking something away. And as Heather talked about directed donation, we have directed donation right on the top of our authorization form. So every family hears about this opportunity to make a directed donation. And it puts families then in the mindset of thinking about who do we know, or being able to visualize dialysis and what that means, and sharing with them, do they know someone who might be able to benefit from this? But it just really, in my way, really humanizes the conversation, just an important aspect of the overall donation. So I spoke to a large Micronesian family a few years ago in a hospital conference room. Pre-COVID, we were able to do that. I think now it's not unusual for our family services team to be meeting some of the large groups outside of the hospital setting, or in areas, sitting areas on the outside, because families have that limitation of access during the pandemic. But in this circumstance, I was meeting with a family in a conference room. There were community members. It was really a multi-generational meeting. And I was talking to them about a young man who had been murdered, and the family was really experiencing a lot of trauma because there was concern that there might have been people who could have helped this young man, but did not. And so, as we worked through some of that, and we talked about the donation option and how his gift might benefit others, ultimately what the family shared was that while our culture says no, our faith says yes. And so I share that because, again, it's important to understand that it's not just culture, it's culture and it's faith. And it's, as families share what their concerns are with us, sometimes they'll link it to religion. And so if we can explore with families what that is, then we can continue a conversation and deepen understanding. And so if you can have with you, items that you find helpful in that conversation. And here I show a picture of a rosary card. Many times we would meet with Filipino families. They would defer to their strong Roman Catholic faith and state that the church does not allow or support donation. And so there are ways in which we can gently share the support of the Catholic Church or other major world religions when families bring that into the conversation. Another thing that's important to understand about Asian communities and many of the Pacific Islander communities as well is that there can be a strong connection to the body or to the deceased body. And so families will talk about concerns about their loved one perhaps haunting them in the afterlife if they consider donation, or they'll talk about whole body. And even some communities where they'll share funeral plans that include cremation might still share feelings or thoughts about the needs for the organs in the afterlife. And so I would just encourage you that when you're having conversations with families, to find that way to be comfortable so that you can gently explore the concerns that the family has, and you can talk about it conversationally. Of course, when people have deep held beliefs, we're not going to necessarily change, this family in this moment, but having the conversation just helps to deepen understanding about donation, and may well reach, this group that you're speaking to, so that they can understand what this gift might mean. And when they talk about concerns related to the whole body, for example, if it's related to concerns about mutilation or body integrity, for us to be able to share with families the kind of respect that is shown to donors. Again, we don't want to assume that people understand that. We have to articulate for families what that donation process is and how much care and respect is shown for the decedent, how they'll be treated. And also for us, we find it really helpful when families know that prior to the recovery of organs, that a moment of gratitude will be shared and that all who participate in that procedure will take a moment to respect their loved one, and that we'll share whatever words the family wants us to share at the time of that gift. I wanted to talk to you a little bit about some of the tools that might be helpful for you. This is something that a shout out to Marcel from Donor Network of Arizona. When he visited us a few years ago, he shared some donor memorial cards that they were using with their donor families. And so we adopted this as well and have found it to help us in multiple ways. One, it is a way for families memory making. It's a two-sided card with a photo on one side and a story or poem or thoughts on the other side. And so families are able to share these cards at their funeral or in thank you cards. So they're able to share within their community that their loved one was a donor. But beyond that, we use it in our community education, and even our family services coordinators will carry multiple cards with them to share with families, to be able to show families pictures of donors who look like them. And so it's a gentle way in which we can normalize donation and show communities that you are not the only one. You know, this is not just you, but this is donation as a norm, a part of the community. You know, as we get to, getting to the end of my presentation, I felt like we cannot talk about donation in diverse communities and not at least touch upon the use of interpreters in the conversation. And so one of the things that we have found to be especially useful, Carol Ann Gordon, one of our family services coordinators, initiated a program of interpreter workshops in which she would bring together interpreters from the community and introduce them to a donor family and to a transplant recipient, share our documents with them, share vocabulary that might be used in the conversation, really as a way to prepare interpreters for what they might experience if they're in a conversation with us. Those workshops have also led for opportunities for us to speak to people in the community and hear firsthand some of the issues and concerns that the interpreters might identify or might know and can help us in our conversations. I think it's really important that we prepare interpreters. One of the things that we do is ask, have you had positive experiences with donation, so that we have a good understanding of the people that we're bringing into our conversation, as well as debrief them after the conversation, again, as an opportunity for us to learn and gather information, but for us to also make sure that the experience that the interpreter had, and we can, kind of full circle with them. I know now of course, our preference is always to have an in-person interpreter to the extent that we can. But of course, virtual has been very common for us more recently, particularly in the pandemic. So I think in summary, I really want to share, it's so important for us not to make assumptions in these conversations. And for us as individuals, any of us who are speaking to families, to be alert to the potential for any of our own biases, not to stereotype families, to really see each family as an individual and enter into the conversation with humility, with compassion, seeking to understand the experience of the family that's in front of us. I'd also challenge you to dialogue with community leaders and healthcare partners in your area that are a part of these communities. I'm sure that, you don't have to look far to find people in the community who also share these experiences and can enlighten you on some of the feelings of the community related to donation. Don't be afraid to have those conversations. For us in Hawaii, there's many cultural organizations, professional organizations. There's a Filipino nurses organization, Philippine medical community organization, social workers in the multiple communities that we can seek out and speak to, religious leaders, all that can provide us some insight into how we can better serve communities. And so I think today we really just scratched the surface. There's so much work to be done. There's so much more that we can talk about, but I hope that I've left you with some things to think about, some things to consider. And I really appreciate the time to share with you today.
Thank you, Felicia. Those are wonderful. I love the memorial cards. Those are something that I have not seen in my own community, or at least here in LA. I don't think that was something that's been kind of rampant and distributed. So I think that's an amazing idea, because like you said, oftentimes they want to see a representation out there. So I think it's important that that gets seen and that gets shared. So there's a few questions on that was sent previously, which I think we've discussed in a lot of ways. You mentioned something about, one of the questions here says, what ways are we going to get the word of donation out to the communities in a positive way? And please tell us the best places to do outreach within this community. Is it a neighborhood festival? Is it a church? So I don't know what you guys do in Legacy of Hawaii as you spread the word in the community. I don't know if that's something that you can share on.
Yeah, I think, again, in the era of COVID, it's been a little more difficult for us to really be in the community. And then, of course, many of the community events are not taking place. But it's not unusual for us to participate in cultural festivals and events, for our team to be out sharing the message of donation in those environments, bringing our donor quilts, the memorial cards, or different like photo stands that you can use, and we'd have some of those photo cards so that people can see themselves in the donors, and also on our quilts, the same thing. There are different involvement in the churches. There are some religious kind of conferences, something called hymn conferences, the Hawaii Islands ministries, where many churches will come together, faith communities will come together, and again, sharing that. And yet more recently, even just setting up and being in the hospital cafeterias, our community outreach will involve just being present in the hospital and sharing donation with people that are in the hospital being cared for. So I think there are many opportunities to do that.
No, definitely. Thank you. And then I don't remember if Heather had mentioned in the study about, some of the cultural concerns that had come up. Obviously a big portion of our Asian American and Pacific Islander community have these concerns about the buried whole situation, right? So I don't know, one of the questions here was talking about how do we explore it further? Like basically, how do you kind of unbury that, right? As far as like, their concerns with the buried whole with the families of API heritage. And I don't know if you have some practical tips that they can kind of utilize when it comes to that.
Mm-hmm. I know I think when we're able to be in a conversation with a family, there is that opportunity to share and talk about that. And one of our family services coordinators will explore with families how we're not going back as we arrive. She'll talk about, the teeth that we've lost, or she'll talk about, people who've had cancer and may have had to have, a breast removed, or, just having just gently, if you're in it, like I said, it's a tough one to overcome, but just being able to speak conversationally with families so that they can think, oh, that's true. We're not exactly as we were. But then when we can go further and really talk about how the gift of that organ then extends life for someone else, and we've been able to make a connection with the individual and their community, it all kind of comes in together. But I would definitely say that the objections to whole body are some of the most difficult for us to overcome.
Yeah, one of the points that you had mentioned too, which kind of resonates for me, and I'm sure for the group, is this idea of being able to identify who the decision maker is and who influences that decision. And sometimes it could be all of them. And you're right, in the spirit of harmony, oftentimes, despite the majority being, in rule, you still end up with a decline. So I don't know if there's anything else that we can do as a community of transplant professionals to be able to overcome that, other than, as we mentioned earlier on in the presentation, about providing the education earlier on before they even make that decision.
Yeah, I mean, I definitely agree with that. And I think, but what we can do in the moment, I think the best that we can do in the moment, as I was sharing, was really do our best to bring together the larger group, to share it in consensus. And I know sometimes that can feel like maybe, well, we may have too many people, and are we going to get a decline because we have more people than we need? But if we're making sure that we have the people that have the authority and the people that have the influence, and we can make sure they get all of the information. Also, if you're meeting with them through an interpreter, you may be able to hear from the interpreter some of the questions of other family members, not necessarily, again, the decision maker, but can share with you some of the questions so that you can continue to address it for the larger group. So I know, as I said, it can feel, it can be overwhelming to meet with families in a large group, but in these circumstances, it may be really our best path forward.
Right. Now, with your study, Heather, do you think there's going to be, like, I'm interested and curious to see if there's like a part 2 of that, in looking at, kind of like what we talked about in preparing for today's conversation, just looking at what is AAPI and what does that mean? I think oftentimes, kind of like what Felicia had mentioned about, let's not focus on and make an assumption on what we a misconception of what we think they're going to respond. And in looking at the real definitions of like who Asians are between the East and the South, I think are the most common ones, right? The Chinese, the Taiwanese, Japanese, those are the East Asians. Southeast Asians are the Filipinos, Cambodian, Vietnamese, Lao, Indonesian, Thai. But then if you dig further, like West Asia is now original peoples of Armenia, Azerbaijan, Bahrain, Cyprus, Turkey. Now you're definitely going into a different category of different cultures and different challenges there. So I wonder if there's like a part 2 in your study for that one, Heather.
I think that would be fantastic. I think for us, the most natural part 2, and this is really based on the history that our research group has had, would be to develop, a communicating effectively about donation training that's focused on Asian American populations. I would love to be able to do some expansion, though, like you're suggesting, of other ethnicities within the larger Asian Pacific Islander, heading. I think it would be really interesting. We are right now working on a paper that kind of debunks the census categorization of Asian Pacific Islander, especially in terms of organ donation, really demonstrating that that is not a catch-all for attitudes about organ donation or knowledge or organ donation related behaviors. So I think we have enough preliminary data. We could go in a lot of directions at this point. So it's kind of exciting.
Definitely. Yeah, that's wonderful. Thank you. And thank you both for, sharing your knowledge, your wisdom, and some practical tips really on kind of debunking the situation and understanding a little bit more about my own culture. And, as we're talking about this, like I'm thinking about ways on how I can even spread it in my own community as well, because it definitely kind of starts from there.
Mm-hmm.
So thank you both.
Thank you for the invitation.
Yeah. Then Deanna, I'm not sure if you have, not seeing any other questions on the chat. So if for everybody that's present, if you have any additional questions, feel free to reach out or put it in the chat box.
Oh, wonderful. And while we wait for, hopefully I unmuted myself. I think I did. Are you all able to hear me?
Yes.
So while we allow for some time for any additional questions or comments or anything like that, I'll go ahead and transition to our breakout discussion. However, I think because we have a relatively small group with us still, I know we're a little bit past the top of the hour, so we have a relatively small group with us. So I think if you're all okay with it, we'll probably just stay in this main session and allow folks to chime in as they see fit. And of course, that includes, any comments that you all may want to share if you have any personal experiences, any questions, of course, for our panel. But also, in addition to that, I'll share these, oops, let me see if my slides will advance. I'll share these questions that the panel kind of put together for some questions for consideration for this discussion. So we're certainly open to hearing your thoughts in this realm as well. But what did you learn today that you'll incorporate into your practice to improve donation within the API community? How do you demonstrate an understanding of the family's cultural beliefs to instill trust and sensitivity when communicating with these families? Or lastly, how do cultural misconceptions and stereotypes create barriers to organ donation and transplantation, and how can we address them? So again, rather than breaking out into smaller groups, I think we'll keep ourselves here in this main session. And if anybody has any thoughts or just general comments that they'd like to add to the discussion, then certainly you're all welcome to unmute yourselves, turn on your cameras if you'd like us to see you, or certainly you're welcome to continue leveraging the chat as well. So with that, I'll also turn the floor to our panel as well. If you want to add any of your own comments to these questions, you're welcome to do so. But I also see a hand raised by Ingrid. So I'll go ahead and welcome Ingrid to share her thoughts.
Thank you very much. This is an amazing presentation. Thank you so much to Heather and Miss Felicia. That's an excellent presentation. I wanted to ask, and it's kind of I think I sent this in advance. Here, hearing from my colleagues and from us that also work with us requesters or in the community with the Asian and Pacific Islander community. One of the things that have come up lately with what's happening with Asian hate and this situation in the United States, this has impacted directly the rates on saying yes for donation or registering as organ donors. Any insight, any light, any guidance that you can give us, not only as the people that work in the community, but mainly the requesters that are having these discussions at the hospital setting with the families that are bringing up this as a reason, or we can identify as a reason for these families not wanting to even engage in any, donation discussion of conversation. Thank you. I appreciate your thoughts.
Wow, I think, well, for me, when I think about that, I can't say that we're seeing that directly in Hawaii, and so I don't have the firsthand experience with that. And I think anytime families don't want to speak with us, if we don't even have the opportunity to get in front of them, we've already lost. But if we can find ways to you know, acknowledge that experience with families, if you can get in front of them, you know, and allow them to share that and just be genuine and hear, you know, hear the pain. Even as I think about it, it just overwhelms me to think that we would treat each other that way. But to just really allow, you know, to allow them to share that, and then to be able to connect on a different way and go back to some of what we talked about, in which, you know, the potential that this gift can impact the community. You know, one of the things in Hawaii, when we talk about donation, and like on that map that I showed you know, how isolated we are, you know, we can see ourselves as a community. And you could expand that and think about when you're talking to diverse communities, that often they will see themselves as a community. And so if we can create a spirit of conversation where we're talking about how this gift has the potential to impact your community, that, you know, perhaps we can get past that. But I would just say that from the beginning, I think allowing families who are willing to speak to us to share that experience, and for us to hear it, to acknowledge it, is at least a beginning of healing in that way. I hope that's helpful.
And I agree completely. And I kind of think back to your presentation, Felicia, where you commented on compassion before consent, you know, and it's really about bringing compassion to that conversation and being genuine, like you've just said too, you know. So I don't have any experience to draw from to answer that question, but I think you did a great job.
Looks like we have Rafia has her hand raised.
Hi, it's Safia.
Oh, Sophia, hi.
Hi. So it's interesting that Ingrid brought up the Stop Asian Hate. So we definitely did see that in the greater New York City area of violence against Asian Americans that was specifically targeted to them because of their ethnic backgrounds. And I'm also thinking of, you know, one of the interviews from the poll that you did that, you know, someone said that as an Asian American, I feel like I've been otherized, and that, you know, in the context of the culture at large, I'm seen as an outsider, not a true American. And so I'm wondering if with certain Asian communities, the like requester would be appropriate. I know that, you know, in an ideal world, we would like to think that everyone has the cultural competency and cultural awareness to be able to speak to anyone. But with such a sensitive topic as organ donation, with the sensitivity around death and dying, and how, you know, that's just such a difficult topic in general, you know, being able to have that conversation with someone where you feel like, I trust that this person gets me, I trust that this person knows where I'm coming from, or even that this person speaks my language. So at Live on New York, we do have a staff person who is from Hong Kong. He speaks Cantonese, but also Mandarin. And, you know, he reports back to us all the time, like, even if the person isn't Chinese, if the person is Korean, there's just the sense of, I'm so glad to see someone who probably gets me more than somebody else will get me. So I'm wondering if maybe anyone wants to comment just on how you feel about like requesters specifically with certain Asian communities.
It seems like that might be challenging in some areas to get a you know, a request staff that is of the same ethnic background. But if you're working with interpreters the way Felicia suggested, you might actually be able to, I just saw, I think in the hospital, one of the hospitals here in Philly, they had a meeting with interpreters, like And I know you just said that it was really funny because it's like the same thing where one of the OPO staff came and did a talk with nurses and interpreters about organ donation. So maybe if you find somebody who you could rely on to kind of interpret in those situations, somebody that you're able to inform and educate about organ donation and really engage as a champion, that could potentially solve that problem. But I do think the staffing might be an issue in some locations.
Something just kind of came to mind to me right now too, and thank you, Sophia, because you're absolutely right. We're spoiled, in New York, and in my own experience in Los Angeles, wherein, you look who's in the office today and you're like, who's here? I need somebody to speak to this family, right? And so it negates the need for an interpreter. And you're right, the requester is definitely an advantage. I remember making phone calls to the Philippines myself, where the authorization party is in the Philippines, and I have to make a phone call in the native language because they don't speak English. And then we're getting consent that way. And it just came to mind right now, and I don't know how everybody feels about like forming almost like a coalition of or a pool that we can pull from. At the end of the day, we're all working from the different, OPOs in different states. At the end of the day, we all have the same goal, is to get donation in the book so that we can save lives. And so I wonder if that's something that's going to be out there in the future, to be able to, because it's hard to get them trained and do, the compassion requesting and being able to understand them. It definitely takes skill, it takes practice. And so I wonder if, all the OPOs in the country will unite in order to form this group of interpreters that we can pull from.
Well, I love that. I think that's a great challenge, Michael, to put out and say, how do we collaborate and do that?
That's our challenge for the group then, right?
I love that, because definitely in Hawaii, we don't have that real opportunity for requesters. We are such a small organization and then such a diverse community. But I will share that what we have done over the years, where there were times where we had a core of volunteers who might be able to come in with our trained OPO staff person, but we would bring in, particularly we had a group of Filipino nurses that were volunteers, and they would go in with us in the conversation and could impart information to the family as well. And we've seen that across the country. I remember there was something in upstate New York years ago where they had a group of mothers who went when it was a pediatric donor. So we have found ways in our industry to address that. But I think as far as the real concept of a true requester, it's not something that's been possible for us. And so then that's why I go back to our expectation and our commitment to compassion for every family that we're speaking to, and using that as our starting point.
There's a question on the chat, which I think it's a good topic of conversation about organ black market, right? So that's another topic in itself that I think we all need to be able to handle. And I don't know if you've got some practical ways on how to respond to these concerns. There's documentaries on Netflix and on YouTube that you can pull from. And you're right, a lot of the black market, even though we're trying to debunk them as a transplant community, saying that they don't exist, but yet, they're seeing real life scenarios close to home that are showing otherwise. They wake up in a basement in a tub of ice, kind of a situation. So I don't know if you've had that experience, or anybody in the group that has that experience to be able to share.
I think we have to be willing to answer that head on and have talking points for how donation and transplantation works in the United States, but not dismiss the information that people are bringing forth. You know, we can be firm about what donation and transplantation is here, but we know that, you know, the issue of using prisoners in China as donors, or you know, concerns about the fairness of the system, or being able to buy, or in India buying, you know, the poor are selling a kidney, you know, to be able to survive. So, I mean, I think those are realities that we know exist, but it's important to educate families in real time about what it means. It means here.
Yeah, and you're absolutely right. I think there's just so much that we're dealing with, between explaining to them what the allocation system is like, right? You know, where I know in all of these third world countries, the allocation system, or how we have it set up here with UNOS and OPTN, doesn't exist. And so you're right, there's this disparity with, like, the rich can get transplanted, and then if I'm poor, I'll just die with an organ failure. You know, so there's definitely a good point to focus on what we have here in the US and how it's happening.
Well, there's also the issue of post-transplant care. So if someone has received a non-registered organ, for example, went abroad to get the organ, many transplant centers in the United States are unable to care for that patient because there's no history about that organ. We don't know what pathogens may be in those, you know, those particular organs. So, I mean, it is an important discussion, and I think we do need to be able to answer to it too.
Definitely a lot more cut up for us, you know, and challenge everybody about furthering the education, you know, within our community and within our own hospitals, right? Teaching them day in and day out about, like, how to declare your people properly is still a challenge that, you know, like leaving the OPO, or when I worked in the OPO to where we are now, I still remember it's like, how come we've never progressed? Like, I feel like we're still teaching them constantly. And so donation coordinators and all of us are definitely have a vital role in that.
A lot of the conversation had come up in our community and everywhere because of this new Netflix series, The Market Heart, which is a Spanish Colombian series that's like a telenovela, but it's a series. So that conversation has come up, and working in the hospital settings and working in the community, I think it's important that we realize that this Black market, not like they portrayed it in, you know, the movies or in the series, but it does exist in several of our countries outside the United States. And that is something that we should or acknowledge when it's brought up. Because sometimes, like if I'm doing interviews or if I'm in a panel, this question comes up sometimes. And so we need to be prepared to actually acknowledge the reality. So we need to be informed and educated. This outreach and educational, you know, piece needs to have, at least for us as professionals, that type of knowledge. And then doing the comparison on how here, that is something that is, you know, really severely regulated. Like Glenn talked about, you know, post-transplant patients, and how even in the allocation side of it, you know, how rare is also for someone to even become a donor. That you even if you are a registered donor, if you don't die, you know, in the circumstances necessary for you to become a donor, it doesn't matter if you have it in your license or not. So doing that education and acknowledging, and not trying to, you know, dodge the subject, but actually acknowledging, having maybe some talking points in our teams, so we are ready and prepared to talk about it if the issue comes up, will make us look more transparent, and that we are really, you know, doing a responsible job educating the communities and acknowledging there's a lot of work that's being done internationally because of these type of situations. One of our medical director, Dr. Delmonico, has been involved for years in this type of efforts. We're very proud to have him, New England Donor Services. This is something that also goes for all of us. Like you don't have to be traveling internationally and meeting all these leaders to do that. We can do that also in our own regions, in our own areas. So I just wanted to add that.
Right. Also remember, or if you're not aware, there is a group called Donate Life Hollywood, and they are working closely with producers, writers. This last Netflix series kind of slipped under the radar, so they are working with that particular Netflix series producers. So, if you find that there are these shows that are being proposed, contact Donate Life Hollywood, and just kind of give them a teaser, and they'll begin working with those individuals.
They have an application, Donate Life Hollywood, where like there's any feedback or any information or any input that we have as far as what's being put in Hollywood. It is a free app that anybody can download. We're actually gonna have Tenaya from Life Hollywood presenting in our AMA conference in October. So this is a really hot topic and something that we all need to be knowing what resources, what tools are out there that we can at least provide as professionals that feedback, like Glenn said, and encourage and to get those talking points out for our teams to use and be prepared. That's a great resource.
That's great to know. Thank you for sharing that, Ingrid. Okay, I don't think I have any more questions on the chat. Any last minute comments from anybody?
Looks like that.
Thank you again for the opportunity to present our work and to be a part of this conversation. I really appreciate being invited to be here today.
Well,
Yes, thank you so much.
And to that point, I just want to, on behalf of the Alliance, I just want to thank you both for joining us. That was an incredibly informative presentation. I think you can tell just by the level of engagement through our breakout discussion, if you will, or our group discussion here, and also just the comments that we were seeing in the chat. I really want to thank you both so much for joining us to share your insights. And Michael, thank you so much for doing such a phenomenal job facilitating the conversation and just being an excellent moderator. So thank you all so much. And to our participants that not only joined us in attendance today, but also joined in on the conversation, I want to thank you for your input as well. So with that, I know we had a few questions or comments rather about the presentation and a few of the resources that were shared earlier today. We are consolidating all of that thanks to our presenter. So we'll be sure to get that out to you so that you all have access to the articles and of course the presentations that were shared today. And the recording itself will be available on our website as well. So we will be in touch very shortly. We look forward to receiving your feedback regarding today's session. Certainly any, if you want to provide us with any feedback regarding future topics that you would like to see, certainly be sure to submit that in your evaluation. So with that, I just want to thank you all once again so much and wish you a wonderful rest of your day.
Thank you, everybody.
Bye, everyone.
Bye, everybody.
Thank you.
Aloha, Felicia. Thank
Aloha.
you.